So, hello everyone. I'm Norlet Bianca Di Parma, and I am your student nurse for today. So, for today's video, I'm going to assess my patient's skin, hair, ears, eyes, nasal, mouth, and neck. So, without further ado, let's get started. So, good morning, sir. I am Norlet Bianca Di Parma, and I am your student nurse for today. So, how would you like me to call you, sir?
Antonio.
So, okay, Mr. Antonio. I would like to inform you that today I will be assessing your skin, hair, ears, nasal, mouth, and neck. Is that okay with you?
Mm.
So, sir, I'll excuse myself first to do the hand washing. I'll be right back, sir. Okay, so Mr. Antonio, I'm gonna proceed on inspecting your hair and your head. So, is it okay with you if I touch your hair and your head? So, I don't see any dandruffs or lice, no lesions or other scars. So, your head size seems to be normal. So, sir, I'm going to pop your head just like this and tell me if you feel any pain. Okay? Do you feel anything, sir? How about here? So, okay. So, my patient's head size seems to be normal. His hair is smooth and smooth to touch and normal. There is no dandruff, lice, lesions, and other scars. Now, we're gonna assess the patient's face. So, as you can see, the palpebral feature of the patient seems to be normal and symmetrical. So, sir, can you please smile for me? Okay, so as you can see, the presence of nasolabial folds are present, and it seems to be symmetrical and normal on the left side and the right side. So now, we can now proceed in inspecting or assessing the eyebrows of the patient. So, it seems to be symmetrical on both left and the right side. So, sir, can I touch your eyebrows? So, the hair is evenly distributed and it is symmetrical. So, I'll check the lashes of the patient. As I observe, it is symmetrical and evenly distributed too. As what I've observed, his eyelids is symmetrical too. Then, sir, can you please open and close your eyes for me? So, okay. As you can see, the patient doesn't have any trouble closing and opening his eyes. So, his eyelids is covering the part of the sclera, which is perfectly normal. Okay, so now we're going to continue assessing the patient's palpebral conjunctivate. So, sir, can you please close your eyes for me? So please take note that wearing gloves is necessary. Yes, sir. Okay, sir, can you please blink for me? Okay, on the other side. Okay, sir, blink. So, do you feel any pain?
No.
Okay, so after doing that, we can now see that there is no swelling or there is no foreign objectives, so the patient doesn't feel any pain at all, so it is normal. Okay, so now we're going to proceed on palpating the lacrimal gland of the patient. So sir, can I touch her face? So it seems to be no swelling, no other foreign objectives, so it is perfectly normal. So okay, now we can now proceed on checking the patient nasolacrimal gland. So sir, can I touch your face again? Sir, do you feel any pain? So the patient doesn't feel any pain and there is no presence of swelling. Okay, so now I'm going to proceed on assessing the patient's conjunctiva. So sir, can I touch your face again? Sir, look up. So the patient's conjunctiva is pinkish and there is no signs of swelling. So it means the patient's conjunctiva is normal. So now for the sclera and cornea of the patient. So the patient's sclera is perfectly normal, both right and the left side, and there is no abnormalities in his cornea. So the sclera and cornea of the patient is perfectly normal. Okay, so now we're going to proceed on assessing the patient's iris. So the patient's iris is dark brown on both sides and they have the same size. Okay, so now we're going to proceed on checking the constriction of the patient's pupil. So okay sir, I'm going to check your eyes again. I'm going to shine a light on your eyes. Would that be okay?
Yes.
So okay sir, I want you to look at that object for a moment. Okay, so both and the right eye pupil of the patient is constricting as it should, so it is normal. So now, I'm going to check the accommodation of the pupil. Okay, sir, I want you to look at that object again for a moment. So, okay, both pupils are constricting again and it is responsive to the light. So now sir, I want you to look at my finger as I shine a light on your eyes. Okay? Just focus on my finger, sir. So okay, both the left and the right pupil are still constricting and reactive to the light. So it means the patient's pupil is normal. So okay sir, for the last part of the eye test, I'm going to show you my fingers on the side and tell me how many fingers did you see while you cover your one part of your eye. So can you please cover your eye for me? So how many did you see sir?
1, 2, 2, 1.
Okay sir, can you blink for me? Okay, then cover the left eye. How many fingers did you see?
1, 2, 2, 3.
Okay, so the patient can identify how many fingers there are, so his eyes is normal. So, okay, now we're going to proceed on assessing the patient's ear. So, sir, I'm going to look if your ear is leveled on your eye. Would that be okay? So, okay, can you please ganyan po yung ulo niyo for me? So, okay, the patient's pin of the ear is almost leveled on his eye. Okay, so now, we're going to palpate the patient's cartilage and mastoid process. So, sir, can I touch your face again? So, do you feel any pain as I touch it? Okay, so there is no sign of swelling. So, we can now proceed on your mastoid process. Do you feel any pain, sir? How about tenderness? Okay, so there is no sign of swelling and there is no mass. Okay, so the cartilage and the mastoid process of the patient is normal. Okay, now we're going to proceed on assessing the patient's ear canal and lymphatic membrane. So, sir, I'm going to touch your ears, okay? So, sir, do you feel any pain while I'm pulling your ears? Okay, so let's proceed on the other side of the ear. Sir, do you feel any pain?
No.
Okay. Okay, so the ear canal of the patient is same as the color of his ear. There is no presence of foreign body, and there is cerumen or wax, which is totally normal. And his ear canal is normal. Okay, so now we're going to assess the patient's nose. So the patient's nose is in the middle of the face or in the midline. There is no deviation to the left or the right. So the septum is normal and the both nostril is normal too. Okay, so now sir, we're going to occlude the one side of your nostril. Could you occlude it for me, sir? So inhale, exhale. So do you have hard time on breathing?
No.
Okay, sir. On the other side, inhale, exhale. Did you have hard time breathing? Okay. So the nostril of the patient is perfectly normal. He doesn't feel any hard time on breathing. So it means there is no obstruction on his nose. Okay, so now we're going to palpate the patient's external nostrils or nares. Sir, we'll touch your face. So, do you feel any pain?
No.
Okay. So, there is no signs of swelling and the patient doesn't feel any pain. So, the external nostrils is normal. Okay, so now we're going to palpate the patient's external nostrils or nares. Do you feel any pain, sir?
No.
Okay, so now we're going to check the patient's internal nostrils or nares. So, sir, I'm going to put my hands on your forehead and tilt it back a bit. Is that okay with you? So, okay. So, the patient's nasal mucosa is pinkish in color. There is no swelling, no foreign bodies. There is no presence of exudates. There is also no septum perforation. So, it is normal. Okay, so now we're going to proceed on checking the patient's cyanosis, the maxillary, and the frontal. So, sir, is it okay with you if I touch your face again? Okay, do you feel any pain, sir? So, there is no swelling. So, let's move to his frontal cyanosis further. Do you feel any pain, sir? So, okay, the patient's cyanosis are normal. There is no signs of swelling and there is no pain at all. Okay, so now we can now proceed in checking the patient's mouth and lips. So sir, can I touch your face? Okay, so the patient's lips is symmetrical. There is no lesions, no bleeding, no edema, or other problems on his lips. So sir, can I touch your lips? Okay, so the patient's lips is smooth and soft. Now, we can now proceed to checking the patient's teeth. So sir, could you please smile for me? Okay, so open your mouth, sir. Okay, so the patient has 28 teeth, which is perfectly normal to a 13-year-old. So the dominant color is white and there is no malocclusion. So it is normal. Okay, sir, could you please stick out your tongue? I'm gonna touch it, okay? So do you feel any pain, sir? So okay, there seems to be no swelling, there is no pain, no presence of exudate, and the tongue is in the midline rather. It is not deviating to the left side and the right side. So it is normal. Okay, so now we're going to proceed to check the patient's uvula. Along with it, of course, is the soft palate. So sir, could you please say for me, like very long okay? Stick out your tongue, then say
Ah.
Stick out your tongue. Say
Ah.
So okay, so the patient's uvula is vibrating or moving as he says then it is in pinkish color and the tonsils doesn't have any swelling, so it is normal. Okay, so now we're going to assess the patient's neck. Okay, so Mr. Antonio, I want you to bend your head to your shoulder from the left and to the right. Could you do it for me? Okay. Okay, so do you feel any pain, sir? Okay, so Mr. Antonio could do it effortless and with no pain. So sir, can you bend your head forward and backward? Okay, do you feel any trouble doing that? Do you feel any pain? Okay, so Mr. Antonio doesn't have any trouble doing what I say and there is no pain. Okay, so the patient's trachea is in the midline position, not deviating to the left side nor to the right side. There is no jugular vein distinction and no presence of thyroid lumps. So the patient's neck is perfectly normal. Okay, so now I'm going to proceed to palpating the patient's thyroid and I'm gonna do the anterior approach. Okay, I'm gonna touch her neck. So do you feel any pain? How about here? Okay, so the patient doesn't feel any pain. So now we're going to palpate if he has an enlarged thyroid. So I want you to tilt your head on the other side. Okay. On the other side. Do you feel any pain? Okay, so the patient doesn't feel any pain and he doesn't have any enlarged thyroid. So the thyroid is smooth, pliable, and non-tender. So now, we're going to assess the patient's lymph nodes. Sir, can I touch your neck? Okay. Tell me if you feel any pain, okay? So, okay. There seems to be no swelling of the lymph nodes, and the patient does not feel any pain at all. Okay, so now we're going to assess if the patient has neck distensions. So sir, can you please tilt your head rather? Okay, tilt more. Okay, on the other side. Okay, so there is no neck distension at all. So the patient neck is normal. Okay, sir. After assessing your body parts, I don't see any problems at all. So everything is normal. Thank you for your participation, sir.